Congressman, your first question is going to come from the audience right here in front of you.
Hi, Congressman. Thank you to you and the others for coming here. My name is Gary Strite. I'm here today as a longtime Cedar Rapids resident and a more than 40-year volunteer for the American Cancer Society who has worked over those 40 years to advocate for policies and investments that decrease the burden of cancer across Iowa and our nation. I'm also here as a proud 2-year cancer survivor. The past few years, we have seen remarkable progress in our efforts to reduce the pain and suffering caused by cancer in this country. But despite that progress, we still have a long way to go. Almost every American family has been touched by this disease. If you are elected president, how will you use the power of your office to put us on track towards defeating the disease that kills more than 500,000 Americans every year? Thank you.
Thank you. Was it Gary? Yes. Gary, thank you for sharing that, and I'm so happy that you've been a successful survivor, and so thank you for stepping forward. So as president, I want to lead the effort to cure cancer, because I believe we're at the threshold of extraordinary breakthroughs right now in all aspects of life sciences, based largely on computing power and big data, things that were not available to the best investigators we've had working on cancer research for the last several decades, but now are available to them. And we've seen huge breakthroughs even in the last several years. Things like immunotherapy, right, which people couldn't imagine such a revolutionary way to treat cancer as turning our immune system actually against the cancer cells, which is what immunotherapy does. So I think this would be, that we're missing a huge opportunity by not having the commitment to basic research that we need to put us in a position to cure cancer, because I believe we can. Because I think the tools are available to our great investigators. So I want to increase NIH research funding materially. I want to increase collaborations with investigators all over the country who are working on this research, in the global community, and have a real commitment to actually curing cancer, while also improving our healthcare system, right, by creating a form of universal healthcare. My universal healthcare program is called Better Care, and it ensures everyone in this country has basic healthcare as a right of citizenship, so that in the unfortunate situation they're hit with cancer like you were, they can get the care they need, and that there's cancer treatment facilities in all communities. I mean, we have a real issue with rural health in this country right now, and one of the areas it presents itself in is with cancer, because there aren't the facilities to provide the treatment like you probably received that puts you in the position to stand up here and say you're a cancer survivor. So transformative increase in basic research to cure cancer, creating a universal healthcare system so that people have access to the care, with a particular focus on making sure it's in rural America.
Congressman, we've had a lot of forums so far this week, and a lot of the people that we've heard from are advocates of some form of Medicare for all. You're not among them, and in fact, you've argued that it will kill the Democratic Party and kill rural hospitals. So why do you say that? And tell us a little bit more about your plan and why you think it's better.
Sure. I'll start with my plan. It's called Better Care. And what it does is it leaves Medicare alone, because Medicare, while it's not perfect, is probably the best part of our healthcare system right now. And then what it does is it gives every American, from when they're born to they're 65, a new plan, a federal basic plan that has minimum benefits similar to what was in the ACA. And you get that as a right. So this way you'll have healthcare from when you're born until the end of your life. But what Better Care does is allow you to have options. So if you don't want the government plan, you can opt out, get a tax credit, buy your own healthcare, or you can take that tax credit and give it to your employer, or you can give it to your union. So it creates a universal healthcare system like Germany's. We have basic federal healthcare, but people have options. The reason it's better than Medicare for all is twofold. As a matter of politics, I think if we run on telling half the country, because literally over 150 million Americans have private health insurance, that we're going to make that illegal, and then you're going to have to get some new government program, they're not going to trust us, and they're not going to vote for us, right? They're not going to believe that it's going to be better than what they have. And there's no reason for us to run on that. We can create universal federal health care without having to take health care insurance away from people. But it's also bad policy. Medicare only covers 90% of health care costs. Medicaid covers 80% of health care costs. And private insurance covers about 120% of healthcare costs. So if you just had government payments, unless we increase the reimbursement rates, which the Medicare for All bill specifically says rates will stay the same, we are by definition underfunding our healthcare system. And I think most hospitals in this country would close, particularly rural hospitals. Because your average rural hospital gets paid twice from commercial insurance as they do from Medicare for the exact same procedure. And if you go to any of your hospitals and ask the administrator how it would be for them if last year all their bills were paid at the Medicare rate, I think most of them would say they would close.
Let's shift to Social Security. When you were in Congress, you were co-sponsor of a proposal, sort of a base closure commission, if you will, in that you would have this group come up with a plan for making Social Security solvent.
Yes.
And then Congress could either say yes or no. In the current political environment, is it even plausible to think that Congress would say yes?
I think they absolutely would say yes. I think it's in fact the only way forward. Social Security, in my judgment, is not only one of the most successful domestic programs this country's ever launched, but it's probably the most successful anti-poverty program we have as a nation. When we launched Social Security, 50% of our seniors lived in poverty. Today, that number's down to about 10%. So we had a very similar dynamic with Social Security from a fiscal perspective in around 1980. Right? Because the dynamics that we have right now, which is Social Security is projected to go insolvent by 2030, that was the same dynamics they were dealing with. And Ronald Reagan and Tip O'Neill created something called the Greenspan Commission, where Democrats and Republicans, 13 of them, went off-site and they worked on a proposal to extend the solvency of Social Security for 50 years. And Ronald Reagan and Tip O'Neill cut a deal because they said whatever they come back with, we'll vote on, up or down. You don't have to vote for it, but you can't amend it. And the reason they didn't want anyone to amend it is because they know the way politicians are, that we put poison pills in there and do all kinds of stuff to grandstand, and that Social Security is too important to do that with. And they extended the solvency. It got a vote in Congress. It extended the solvency for 50 years because it passed. And the poverty rate of seniors when they took this vote was 20%. Now it's 10%, which shows you can actually extend the solvency of Social Security without hurting the program. So Tom Cole and I, a Republican from Oklahoma, introduced the Social Security Commission Act of 2017, of 2018, to do that exact same commission, because it worked. And I think that's the only way we can deal with it. But I think we'll deal with Social Security because it is the most popular program, and it's probably the most bipartisan program in this country. So I can't envision a scenario where Democrats and Republicans don't ultimately come together and do what we need to do. The problem is we need to do it soon, because the longer we wait, the tougher the solutions get. And that's why I've advocated for doing it now.
You proposed to deal with prescription drug costs in a slightly different way than we've been hearing from other candidates. You proposed an excise tax on the price difference between drugs sold in the US and other developed countries. Why take this approach, and how do you avoid having the cost transferred to consumers?
Well, I have also proposed, which I think most of the other candidates have also proposed, allowing Medicare to negotiate the rates with pharmaceutical companies. So that's part of my proposal too. And it's ridiculous that we don't allow Medicare to do that, because the federal government is the largest buyer of pharmaceuticals and they should negotiate the prices. But the bigger issue in many ways is the fact that most of the world is free riding on US citizens as it relates to this issue. And what I mean by that, if you go to other wealthy countries like Germany or Spain or the United Kingdom, their citizens on average pay a third to a quarter of what we do for drugs. And I'm all for selling drugs to poor countries at low prices because they can't afford it, but I think US citizens should pay the same as other wealthy nations. And so what I've called for as president is for the United States to basically make this a trade issue with the other wealthy countries in the world, where we work together, say as 20 wealthy nations, to negotiate the prices so that US citizens are paying the same as other countries. That may result in prices going up in other countries while they come down here. Because in some of these countries, they actually sell drugs below cost. But it doesn't matter because they just keep raising the prices here. So to make this point, I've proposed a tax. And the tax is equal to 100% of the price differential between where a pharmaceutical company sells a drug here and where they sell it in the G20, the other wealthy countries. So if they sell a drug for $30 in the G20, and they sell it for $100 here, they would technically owe a tax of 100% on $70, which is the difference. Because I want them to lower the prices here, and maybe they may have to raise them there so that we all pay the same price.
Why would other countries agree to participate in that if they might see their drug prices go up?
Many of these countries are our allies, and I believe in allies. Unlike the current administration, I think these allies are kind of a singular asset. They're our friends, but even with our friends, we have a lot of back and forth discussions. And I think if you sat down with these countries and you laid out the facts, and the facts are unmistakable. The US citizens, you, subsidize the entire global pharmaceutical industry. Our taxpayers, our citizens are funding this whole industry. And we can't allow that to continue. Right? We want this industry to continue to have innovation. We want this industry to continue to put forth remarkable new drugs and cures and immunotherapy. But the cost of that investment should be shared, in my judgment, by all the wealthy nations. And so I think every once in a while you got to sit down with your friends, you got to put a lot of issues on the table, and you got to say, this is a priority for me.
A house is often the most significant financial investment an individual or a couple will make in their lifetime. Are reverse mortgages a good financial tool?
I think to a limited extent they're fine. Right? I think to a limited extent they're fine. But I think they have to be regulated.
How so?
Well, you got to put limits on what loan to values are allowed, what rates can be charged, and what the terms are. Because I think the opportunity for predatory lending with reverse mortgages is very, very significant, right? Because you have a slice of our citizens that get to the point where they need more money during retirement, and they own a home, and they have a lot of equity in it. And that creates the dynamic for deceiving practices to potentially be applied to convince consumers to sign up for these reverse mortgages. Again, the theory of a reverse mortgage is not a terrible thing, which is if you own a home and you have no mortgage, for example, and you were to take on a mortgage and borrow a modest amount of money every year, and the mortgage were to go up to 20 or 30 or 40% of the loan to value of your home, and you could use that money for whatever you need at that stage of your life or to help members of your family, that's totally fine. But to allow it to be completely unregulated, where it could put our seniors in a position where when they're most vulnerable, they could be under huge pressure with their home, I think we have to make sure we protect against that, which is why I care about things like a strong Consumer Financial Protection Bureau, et cetera, to actually make sure we're policing those things.
There probably wouldn't be a need for reverse mortgages if people could pay for their long-term care. I mean, that's the reason people do take out these financial tools. Long-term care is not covered by the Affordable Care Act. Would it be covered by your plan? And if so, how?
I think having a long-term care option does make sense. You know, taking out long-term care insurance. Are you talking about long-term care insurance?
Well, I'm talking about, do you include coverage for long-term care
Yes.
under your health care plan?
Right, because what would happen with my health care plan, Better Care, is you'd leave Medicare alone, and then you'd create this new program that everyone gets from when they're born to they're 65. And you would roll Medicaid into that plan. Because Medicaid is a broken system in this country. It's broken here in Iowa, it's broken all around this country. And as part of rolling Medicaid in, you would move the long-term care component of Medicaid to Medicare.
Okay, but you'd still, under Medicaid, you still have to spend down your assets,
Absolutely.
right? Which is why all these reverse mortgages happen.
That's right. So you'd actually create a long-term care benefit as part of Medicare. Right, because the problem with Medicaid's in many ways an odd healthcare program right now, because most of the expenditures are either for kids or for seniors in long-term care facilities. So it's one of the many reasons Medicaid is a broken program, because those are two difficult.
It's also mental health, yeah.
No, it has a lot of benefits, but if you look at where it spends most of its money, it's on long-term care, it's on pediatrics. So it makes much more sense to have a long-term care benefit as part of Medicare, because Medicare is obviously a healthcare program that's designed more for our seniors. So it's more lockstep with long-term care options. So that's where it should be located.
Let's shift to a different topic. There are many European countries that have a mandatory retirement age. Given the global nature of our economy, should there be some law that requires international actors like maybe Volkswagen to adhere to US law when it comes to age discrimination and perhaps encouraging or forcing employees out the door?
Well, I don't think we should have mandatory retirement ages.
I'm not
by law
saying
here.
that,
Yeah.
but you have companies like Volkswagen who are in places like Tennessee who are trying to force some
Yeah.
of their employees to retire, adhering with the home nation's policy.
Yeah, I think that's age discrimination. That's my view. I mean, these retirement age concepts are from this outdated view that people used to have that it was never an expanding pie. So people used to say, well, the only way to create a new job is for someone to retire. That's kind of where these things came from. Mm-hmm. And we all know that's not the way you should think about your economy. You should think about your economy as a growing pie. And you should have the right policies to encourage growth. So if you actually think about your economy that way, things like mandatory retirement age are stupid. Right. And they're also discriminatory. So I don't think European companies that do business in the United States of America should get a pass from complying with US laws under any sense of the word. So no, I don't believe Volkswagen should be allowed to impose mandatory retirement ages, in my opinion.
So Social Security essentially means that you are, to draw Social Security means that you are no longer a full-time employee. There are limits on what you can do on a part-time basis. Mm-hmm. Should those be changed, especially given workforce demands, number one, and we may be living longer?
Yeah, I mean, we're definitely living longer, even though the aggregate data isn't showing that, but that's because of things like opioids, et cetera. But in general, we're living longer, and that's great. And we want to encourage people to work longer because the data is clear that the longer you stay engaged, whether it be work or volunteer work, et cetera, that correlates to your physical and mental health.
So how do you do that? Do you raise the retirement age, or what do you do?
I think there's a lot of innovative programs. There's been some pioneering stuff done in California, for example, where they've taken California state employees and they've encouraged them to start working 3 days a week, doing volunteer work 1 day a week, and then having 1 day a week off. So they go from 5 days a week to 3 days a week working and 1 day a week volunteering. But they extend how long they stay working. And that's been proven to be good for all the stakeholders. It's proven to be good for the person because it encourages them to work longer, which correlates in many ways to better physical and mental health. It's been good for the communities because it's created volunteer opportunities for our seniors to engage with all the needs we have in our communities. And I think our seniors are an incredible untapped resource, right, that should be deployed against a lot of the issues we have, mentoring, et cetera. And it's been good for the California state pension system because it's allowed them to defer when they make payments. So it's been this triple bottom line based on smart, innovative policy where you're thinking holistically about the needs of the person and of the society. So I'm very much in favor of innovations like that to allow our seniors to think differently about this last phase of their work, where they can stay engaged, which I think is incredibly important, and they can stay as valuable contributors to whatever organization or enterprise they're part of, but also encourages them to maybe become more involved in their community, et cetera.
Let's talk about pensions for a second. 1.3 million Americans are at risk of having their pensions fail without congressional action dealing with these multi-employer pension funds. Should Congress, what action should Congress take, if any, to deal with
Congress
these pension
should,
systems?
I think the federal government should stand behind these pension funds because this is something that an individual relied upon, and they were not in a position as an individual to underwrite the risk of that particular pension, and that is a risk that it is in the best interest of our country for society to insure. So I think the federal government should stand behind these multi-employer.
Was the Obama-Biden administration in the wrong when they said that you could reduce benefits for these pension systems?
I mean, I'm not in favor of reducing the benefits. I mean, how you define that, people have different definitions of what reducing benefits means, So I don't like to answer things in those clear absolute terms, but in terms of the principal benefits that someone is expecting from their pension, I would support those being maintained.
Before Senator Harkin retired, right after he retired from the Senate, he proposed a new retirement savings plan that would serve as kind of a bridge between Social Security and traditional retirement programs, such as pensions or 401ks. Are you familiar with that proposal at all? Do you support it?
I do. We clearly need a supplemental retirement savings program. And I think innovations, including some ideas I've come up with, which not only create portable retirement systems, because we need more of those, clearly, but also to have systems that encourage people to start saving earlier, including having the government provide some investment in these programs to help encourage people to start saving. Because the power of compounding is extraordinary. So if people actually start saving literally when they're born, a couple $100 set up in every citizen when they're born, compounding across time has a material impact on what their retirement savings could look like. I'm also in favor of something, switching gears to climate change for just 1 second. I have a proposal that puts a price on carbon. It's a carbon fee, carbon pricing mechanism. Some people call it a carbon tax. And it raises the price of fossil fuels. It raises a lot of money. But unlike a lot of other elected officials, what I'm calling for is all of that money being given back to the American people in a dividend. So it's called a carbon fee of dividend. You put a price on carbon, makes fossil fuels less attractive, it raises a huge amount of money, and all that money gets put in a lockbox and paid to the American people in a dividend. What I've proposed is the American people can take that dividend a couple of different ways. They can take it in cash, or they could take it in a retirement savings account, in a health savings account, or in an educational savings account. And we might put an incentive on them to do that, maybe give them 105% of their dividend payment if they choose that. Because those programs are very successful, because they allow people to save on a kind of a tax-free basis. The problem is not enough Americans take advantage of them. You know, it's generally a smaller slice of the country who tends to be very well off takes advantage of those programs. So I think it would be great, and you can see the way I think about things, these double, triple bottom lines, as part of dealing with climate change and putting a carbon fee and dividend program in place to also create an incentive for more Americans to take their dividend in a retirement savings account.
You mentioned consumer protection a few minutes ago. How do you protect consumers from spam and perhaps the spam they get on their phone or through their email?
Well, you know, we have to pass laws.
And what laws would you advocate?
Well, I think people should be able to opt out, not only from domestic spammers, but from overseas spammers, right? Because that's the loophole we have right now, right? You can have these no-call things. I mean, these annoying calls you get at home. Now everyone's worked around them, because if you operate overseas, you can actually engage in these things. So I think we should pass law preventing that. But there's a lot of other protections. I mean, I was at the AARP headquarters in Washington a few years ago, because I was the lead member of the House that was rolling out something called the fiduciary rule, which was effectively an Obama-era rule that limited or put some disclosure requirements around fees that financial advisors could charge. Because there's been a lot of data to suggest that excess fees really strip 20 to 30% of a retiree's savings, and that we need more transparency, and we need to change the standard. And the standard that I advocated for under this fiduciary rule is that a financial advisor has to put your interests first. It's called a fiduciary standard. Most of you probably think that is the rule, but it's actually not the rule for a lot of retirement. And so those kind of things are really important as well.
How do you get more people to go into direct care professions? We have a serious shortage in this country, and especially in rural underserved areas like Iowa.
Well, I think ultimately it's the cost of the education and then the compensation they receive, right? Those are the two things that people think about when they're making the decision about these careers. What does it cost me to get the skills and education that I need to actually get trained so I can do this? And what is my compensation going to be when I actually get a job? So as you think about wanting more caregivers in rural America, because I think we have a rural health crisis in this country, and providers are leaving rural communities, hospitals are closing, et cetera, which is the point you're getting at, Kathy. So I think we have to do things to make education more affordable, but we also have to use technology more. I was on the board of Georgetown University for several years before I ran for office. And I was on a committee that oversaw the medical school and the nursing school. And while I was there, we took the nursing school online. And the enrollment in the nursing school increased about 5-fold in 2 or 3 years. So you were taking the terrific Georgetown nursing program that they had, and they were extending it out all across the country, where people were getting the education on a distance basis, and they had collaboration with local hospitals for their on-site stuff they had to do. And we just need to do so much more of that to make it easier for people to get the skills they need. But then we have to create financial incentives for them to actually settle down in rural America. That revolves around student loans. That involves, I think in many cases, grants from the federal government to make sure that local health systems can actually afford these people.
Great. We are a little bit over time, but thank you for answering our questions. We'll give you 30 seconds to wrap up if you like.
So hopefully from our comments here, and thank you for the really intelligent questions, you can tell that I'm about real solutions, not impossible promises. I think what's happened to this country in the last several decades is we haven't addressed our most basic issues in healthcare, in education, in climate, in the fiscal trajectory of our country, in technology policy. We've been too busy fighting, and we haven't spent enough time doing. And as president, I will be committed to what I call the politics of progress, which is to actually work together and get things done. I've done it my whole life. I grew up in a blue-collar family, first in my family to go to college. I was a successful entrepreneur, created thousands of jobs. I was the youngest CEO in the history of the New York Stock Exchange. My company's got awards from the Obama administration for our practices, our ethical business practices, and then I had the privilege of serving in the Congress of the United States. I'm a doer. I have new ideas that confront all the issues we face in our society, and I have a plan to make them happen. Because what we don't need is pie-in-the-sky ideas, like on healthcare. My plan, Better Care, gives every single American healthcare as a basic human right for free. But what I don't do is subscribe to this politics of subtraction, where you got to run around and take private insurance away from half the country. I mean, that's terrible policy and it's terrible politics, and I think most of us know it. So what we need is common sense solutions. We need to bring this terribly divided country back together again, and we need to get America working again. Right? I think we should leave the world better than we found it. That's why I ran for office, because I think we can do it. This is a magnificent country. We have every advantage any nation could possibly want to have in 2019, except for one thing. We don't do anything anymore. And for all these issues, there's good solutions. We need a president who's committed to actually finding that common ground with new ideas, ideas that make sense, and getting them done, so that we actually leave the world, for my kids, for your grandkids, hopefully one day my grandkids, better than we found it. And that's why I'm running for president. I want to thank you for these great questions. It's great to be here with the AARP, and God bless you all. Thank you.
Thanks very much.
Thank you.